is being recorded. Good afternoon, everyone, and welcome to today's webinar. The webinar today is Telemedicine, Managing Your Risks. I'm Kathy Bryant, and I'll introduce myself in just a moment. I am the Manager of Products Development and Consulting Services at TMLT. Joining me today is Cassie Turner.
Hi there, Kathy. I am Cassie Turner. I am a Senior Risk Management Representative here at TMLT, and I also work alongside Kathy at times with some things related to HIPAA.
We would just remind you that neither Cassie or I are attorneys, and we're not providing legal advice. If there's anything that you feel like you need an attorney's to weigh in on with the webinar presentation today, feel free to contact an attorney of your choosing. Well, telemedicine is everywhere. We see it everywhere on the internet, just about any place that you look. There is something about telemedicine. Certainly, the recent pandemic has certainly brought telemedicine into a whole new light, creating alternatives to in-person visits and offering care from remote locations. Today, we're going to be discussing how to manage the risks associated with telemedicine by helping you to understand the legal risks of telemedicine, planning how to use telemedicine, documenting the telemedicine visit, and tips on conducting telemedicine visits. Before we get started, we'd like to do a quick poll to find out where you are on your telemedicine experience, from not using telemedicine or different ways. It looks like a slight majority are using Facebook or Skype or some other methodology used under the COVID emergency. Uh, the second most looks like it's integrated into the EHR.
Okay, so we're going to jump right in here with taking just a quick look at some legal risk and litigation when using telemedicine. Claims of medical malpractice liability involving telemedicine are rare. Generally speaking, those claims are very similar to in-person care, such as incorrect diagnosis or incorrect interpretation of an image or a diagnostic result. And then common allegations associated, again, very similar to in-person care, miscommunication, patient not understanding, or that the telemedicine visit is not as effective as in-person. And then, of course, privacy and security allegations that are related to HIPAA privacy and security law. So here we have quite a few items for you guys to take a peek at. I'm not going to go over all of them, but the takeaway here is that know the law in the state where your patient is located. As you can see, there are a variety of laws pending licensure, reimbursement, and for Medicaid and for private payer. So we include these here for you to take a peek at. But again, if the person is outside of the state where you're licensed, then you want to be sure that you're aware of those licensing laws and that you have that in place before moving forward with treatment. So again, practicing across state lines, you need a license in the state where the patient is located. There are a few minor exceptions that you usually see here in Texas. A couple of those would be one, for example, if your patient that you have been treating for many years is on vacation, they forgot their medication, and they call you from another state and ask for a refill of a prescription, that's certainly something that you could handle. If they're having some type of symptom while traveling in another state, again, something that you could do a telemedicine visit for to assess and offer them a telemedicine visit. A scenario that may need a little bit of caution, let's say you have a patient who moves to another state and 6 months down the road they call you looking for a refill or looking for some type of telemedicine visit. That may be one that you want to, just proceed with some caution and encourage the patient to establish care in the state where they are currently living. So the Centers for Medicare and Medicaid Service, we include this information for you just as a resource. The takeaway here is that the CMS has broader circumstances due to COVID-19, as you probably are aware. The main takeaway for telemedicine now is that it is considered same as in-person and it is paid at the same rate. And again, the resources are here for you to take a look at more in depth at your convenience. And again, with HIPAA, as we've mentioned, and we don't want to leave them out, they have also lessened some of their rules. They want to empower you all to provide care to patients during this pandemic time. So they are going to use their enforcement discretion and waive penalties for HIPAA violations against providers that are serving in good faith through everyday communication such as Facebook or Skype. I will mention, not Facebook, I'm sorry, FaceTime. I want to make a point that TikTok and Facebook are not platforms that they would recommend or approve. So FaceTime or Skype or within your EHR are platforms for doing telemedicine visits that the OCR would approve of. Again, we would just encourage you to remain vigilant with your security measures. We do know that there is COVID increased attacks, particularly with phishing. Probably not the most prevalent thing on your mind with everything else, but again, just an encouragement to maintain those security measures that you all have been doing prior to COVID. And here, if you are using a platform outside of your EHR, these are just some basic guidance for you to take a look at as far as getting an vendor agreements with business associate agreements if you're using someone outside of your EHR. We understand that some patients are going to be a little hesitant entering into using telemedicine, but we do see that most of them feel that the benefits outweigh the risk, particularly when they're made aware of their risk from a privacy and security perspective at the outset. So these are the Texas telemedicine requirements, and the rules are cited here for you again as a reference. I'm not going to delve off into these too much. Kathy is going to talk about complaint notice and privacy notice here in a bit, but there is an FAQ that we include for you on telemedicine from the Texas Medical Board. And then what are the requirements for telemedicine within Texas? So basically, telemedicine is delivered to patients physically located at sites other than where the provider is located. And the takeaway is that the same standard of care applies to in-person setting as it does to services provided by telemedicine. So what are the primary requirements for telemedicine continued here? Telemedicine can be provided in a synchronous manner or in an asynchronous manner. And those will be done either, as we've mentioned, via your Skype or via your EHR. And now with things being as they are, we do see a lot more medical devices that can transmit this asynchronous data. So you may be seeing folks with ear probes or the cardio mobile machines, diabetes management, some of the INR management, things that are done in home care that are being transmitted over in an asynchronous manner, but those are allowed with the telemedicine. Again, just an overview of the requirements here for you all to look at. The takeaway is you want to provide quality care, prevent abuse and fraud, and also if you're working with advanced practice providers, nurse practitioners, or with PAs, that you're ensuring supervision of those folks as well in their telemedicine visits as well. As I mentioned earlier, the quote unquote problem with telemedicine in Texas is that the same standard of care would apply in a telemedicine setting as an in person setting. So, when you're looking at your patients and you're scheduling them, this is something that you're going to want to consider and ask, can I provide the same standard of care for this particular patient in a telehealth visit or a telemedicine visit as I can if they were here in person? So this does create some challenges, we realize, with some patients, but again, something to consider as you're moving forward scheduling your patients for telemedicine visits. Using the telephone, if you're not going to use a video platform, physicians may now use phone-only encounters to establish a doctor-patient relationship. And you can also do follow-up care by phone encounters only as well. And again, the resource there is for the Texas Medical Board. You can check that out if you're interested. And at that, I think we have another polling question here for you all. How many of you have written policies and procedures that are specific to telemedicine?
It looks like the majority do not have written policies and procedures specific to telemedicine as required by the Texas Medical Board. But here's the good news. We're going to talk about that and give you some great resources. Generally speaking, to have successful and productive telemedicine visits, we understand that you need to have those policies and procedures, first because they're required by the Texas Medical Board, but also because they give you a good basis for staff training. You'll want to train your staff because they're going to be a huge asset to you, as well as uh, educating your patients. The good news on the policies and procedures for telemedicine is that the Texas Medical Association has provided a tremendous amount of resources on policies, procedures, and forms for telemedicine services. They have an entire section of their website dedicated to telemedicine. It's real easy to remember. It's texmed.org/telemedicine. And I've just done or provided a list of the free resources that they do provide. And we thank the Texas Medical Association for not only making those available to members, but those are also currently available on their non-member website as well. This is an example of one of the policies and procedures that they have. And I think this one's a real important one. It's on patient selection. The purpose is to identify patients with certain complaints for which appropriate care may be provided via telemedicine. This would be a great one for educating staff because obviously if a patient calls and wants to have a telemedicine visit, you need to provide them your staff some guidance on what's an appropriate telemedicine visit. So I would encourage you to take a look at this and other resources that the TMA has provided. One of the specific requirements under the Texas Medical Board Rule Section 174, which is the telemedicine chapter, is that physicians that communicate with patients by electronic communications other than telephone or facsimile must provide patients with written or electronic notification of the patient's privacy practices, the physician's privacy practice, prior to evaluation or treatment via telemedicine medical service. In addition, a good faith effort must be made to obtain a patient's written or electronic acknowledgement, including by email, of the notice. Cassie mentioned, just in passing, that the board in Chapter 174 does have some specific requirements for development of protocols. Specifically, you must adopt protocols to prevent fraud and abuse through use of telemedicine services. In other words, you have to bill for the services that you provide. You also must provide that telemedicine complaint notice. That complaint notice may look very familiar because you should all have it posted in your offices as well. But there are actually two different rules that relate to this notice posting. But in telemedicine, it's physicians that use telemedicine must provide notice of how patients may file a complaint with the board on the physician's website or informed consent materials provided to patients prior to the telemedicine visit. Obviously, if you're using telemedicine visits, perhaps the easiest is to just make sure that this notice is on your website. And then Section 178.3 talks about that it has to be at least 10-point font size. You also have to provide a privacy notice, and that notice has to be consistent with the federal standards under 45 CFR Parts 160 and 164. And for those of you who don't recognize those, that's HIPAA. You all should have your HIPAA Notice of Privacy Practices available not only to new patients, it should be posted in your waiting room, as well as posted prominently on your website, with and without, whether or not you use telemedicine or not. In your notice, you do need to make sure that the patients know that the telemedicine service is subject to the same standard of care, and that you'll be making the same medical records as you were if you were doing an in-person visit. As you get more familiar with telemedicine visits, and if those especially become part of your routine, you're going to just have to experiment with how is it best to work telemedicine into your schedule. Is it best to work them in just as a time slot in your schedule, or is it better to set aside a block of time during the day that all you're going to do is do telemedicine visits? You'll need to figure out how to schedule them and basically help your staff understand. It's really important that your staff understand the technology. There are some of the telemedicine platforms that allow for a medical assistant, for instance, to actually start a patient interview and then seamlessly hand it off to the physician, or while it's all one seamless visit. Other solutions don't work that same way, and it might be easier if your medical assistant called the day ahead or prior to the visit with the physician to actually walk through what the instructions are with the patient so that they will be ready at the time of the call. The worst thing that can happen is the patient's trying to download an app on their phone or another device while the physician is sitting there waiting to start the visit. So educating your physicians or your patients ahead of time is really important. They need to know what they need to get ready for a telemedicine visit, what to expect, what technology is going to be used, who's going to initiate the visit, as well as having a list of their current medicines available, because most patients are not able to just generally uh, or tell you what medicines they're taking.
So now that you have your patient scheduled and they're aware of what their coming and expectations are for telemedicine, we're going to look at documenting the telemedicine visit. Here are some general standards or requirements that AHIMA puts forth of what a telemedicine visit should include when you're documenting into the medical chart. They also provide a list of minimum items that they recommend be contained into the medical record. We're going to also look at the Texas Medical Board and what they require, and you'll see it's very similar to what AHIMA recommends that you document as well. For the Texas Medical Board, Chapter 165 is your friend if you're looking for what an adequate medical record is. They outline it very detailed here, and we're going to go through that. With telemedicine, the same standards apply as an in-person visit, so there really aren't any documentation differences for in-person versus a telemedicine visit. You're still going to want to capture what Chapter 165 of the Texas Medical Board, the Texas Administrative Code, is putting forth. So primarily, they want to see quite a few elements that would cause them to deem it as an adequate medical record. They want to see the reason for the encounter, relevant history, physical exam, findings, assessment, impression, or diagnosis. They want to see a plan of care, treatment, the date and legible identity of the observer, having past diagnoses and records available for the consulting physician, rationale for the diagnostics if those are going to be ordered or included. They also want to see patient's progress, response to treatment, any changes in diagnosis or noncompliance, any risk factors should be identified, and then a written care plan that would include treatments, medications, any referrals, family and patient education, and then specific instructions for follow-up should also be included. In addition, if there are any consents for surgery or inpatient procedures, you will want to document those as well. Include a summary of the documentation. Then you'll also include billing codes and any other non-biographical fields that you're including into your medical record for that particular visit. Additionally, if there's an amendment made, then you'll want to include that. And then if there are other records that are salient records from other providers, you would want to make sure that those are part of the patient's record as well. So again, just as a high-level overview, I know that those slides contain quite a bit of information. Documenting a telemedicine visit would be the same as an in-person visit, and you would want to follow Chapter 165 of the Texas Medical Board rules. Include your interview, assessment, limitations of the visit, labs, diagnostics, response to treatment, guidance, patient education, follow-up instructions, questions. These are all things that would be required. Sometimes we get questions regarding coding, in that coding has some lower requirements, and they do. So just keep in mind that you'll want to make sure that you're following what the Texas Medical Board requires of you in addition to the coding.
We want to give you a chance to
Go ahead, Kathy. I jumped over.
sorry, to answer one more polling question. What has been the response from your patients regarding telemedicine visits? Looks like overwhelmingly the telemedicine visits have been a positive for your practices, and we're excited for that. We want to just finish up this section of or finish up the webinar with a few tips on successfully conducting telemedicine visits. There is a great deal of information that's coming out in the literature about successful tips on conducting visits by telemedicine. One of the resources that TMLT does is we provide SlideShare, which is a quick internet-based resource. And we have a new one out that's what every physician needs to know about website manner. Website manner is the new bedside manner. The webcam creates an intimate vantage point. It sees everything. So that makes the room design important. You want to make sure that whatever the backdrop is on your webcam is a professional interaction, but it also needs to enable a comfortable interaction as well. It's recommended that you place your camera above the face for an accurate estimation of gaze. If it's too close, it can cause patients to feel like they don't have any personal space. Lighting behind the camera will help illuminate your face, and it's always best to have the optimal screen quality of 1080 or 720 and a monitor aspect ratio of 16 to 19 or 16 to 9. All very technical. There's a lot more detail in that SlideShare if you care to take a look at it. TMA has provided a really nice webinar, a telemedicine visit checklist. It goes over location, technology, audio, the visual, and general information. Patients experiencing telemedicine give high ratings to their providers. It's suggesting that the efficiency of the model for non-urgent medical visits really is shifting towards telemedicine. In a recent study by Prescaney, they found that 4 key things were important for successful telemedicine visits: authenticity, agenda planning, empathy, and having a closing checklist. And I think that these are real important to work into practices because they will make for a more successful visit. In fact, the chairman and CEO of Prescaney said in an interview recently, the rapid adoption of telehealth has enabled caregivers to meet the needs of patients with the level of attentiveness, expertise, and empathy provided during in-office visits. And I think for some time, some believed that that might not be possible, but we're certainly seeing in post telemedicine visit surveys that this is the case. Of course, there's always impacts of noncompliance. If you're practicing, especially across state lines, you may have to worry about potential investigations for more than just one single state medical board. So you want to know before you start engaging in telemedicine across state lines in particular that you're meeting all of the rules. Looks like we have a few questions. We're going to kind of scroll down through them. While we're starting to review the questions, we'll just remind you that the downloadable files are on the lower left-hand side. You simply click on the file name and hit download files, and it will download to your device. Also, the webinar is being recorded, and you'll receive a link to that recorded webinar within 24 hours. Cassie, do you want to take the first question?
Sure. So one of the first questions is, do I need a specific license for telemedicine? Again, as we mentioned, you will want to make sure if you're going across state lines that you do have license for those states that you're going to be seeing patients in other states. Again, if it's outside of an exception for maybe just a refill for a patient that's currently your patient. I would also recommend that you speak with the underwriter of your medical malpractice policy to ensure your coverage. But as far as a specific license that is specific to telemedicine, I'm not aware of any that exist yet. Again, just making sure that you have the state licensure for the states that you will be practicing in.
The next question is reimbursement for telehealth lesser than regular visits? That's very dependent on who you're billing. There were some special exceptions made that as far as Medicare visits, Medicaid visits, and also some of the private payers had waived some of their usual requirements during the pandemic. I would just suggest that if you have questions about billing, I would again point you at the TMA website. They have some resources on billing, but also just simply check and make sure with the individual payers.
So next question, does telemedicine also include phone calls or just video calls? In the state of Texas, you can establish a patient-physician relationship with a phone call and also do follow-up phone calls for follow-up care.
As far as the establishing of patient care, that is under some of the emergency COVID rules. We don't know how long those are going to be in place, but for now, you're able to do that. The question is, before COVID, can we refill medications in another state where we're not licensed? I'm guessing that it's a patient that you have an established relationship with and they're temporarily located in another state. And to my knowledge, that yes, you can do that. Will the notes be available after the webinar ends? If so, how can we access? A copy of the slides are available. It's the Telemedicine Managing Your Risk on the lower left-hand side. Simply click on that and download the files. And as I said before, the recorded version will be available on by tomorrow, and we'll email that link to you.
One question, Kathy, it's actually one that you and I were talking about earlier today, documenting a physical exam over the phone, which could be a little bit challenging. So we're talking if you do hear the patient coughing or along those lines, listening to those types of things, there are some elements that you can document over the phone. Obviously, there are going to be many that you are not able to, but again, there are some, and I would say document what you're able to assess over the phone.
That's true, and I think it's important that you document the limitations. Obviously, by simply stating in your note that due to the fact that it's a telemedicine visit, you can't auscultate the lungs, for instance, that type of thing. How do we get an informed consent when right now we're trying to keep patients out of our office? I think there's lots of ways you can get that informed consent. You can email the patient the document and they can email it back to you. You can use your EHR portal and have them sign the document. Some of the systems have the consent built into their platform, and they can be electronically signed as well. The question, as a pediatrician, my young college kids may need continued management of their ADHD medication. It's been hard for them to find care for these on campus in other states sometimes. Would episodic care be appropriate in this case? The patient is still a Texas resident, but would be in the other states for some period of time. I would think that that would be an exception. Uh, those patients might not be able to obviously see you, but they may need to arrange visits, like when they're home at the holidays or summer.
So the next question, the disclaimer pre-COVID was sent via patient portal versus email. Our patient portal, text message, and web postings options. I would say that your patient portal is going to be your most secure method for sending out information. Typically, text messaging and email, we would just be cautious in moving forward with those.
We're dependent on the patient for their attestation that they are in Texas or wherever they claim to be. What's the rest of that question? I've only seen one telehealth platform that claims it can geolocate patients. Wow, that's an interesting thought. I hadn't really thought about that one because that is an interesting concern. But I do think you have to probably trust the patient that they are giving you accurate information.
What is the status of face-to-face hospice visits via telemedicine? Kathy, correct me. My understanding is that with COVID, that those are also allowed to do telemedicine visits as if you are able to.
As far as I know, that is the case. I don't know of any exception for hospice. Um, but if you have further questions about that, you can email us at consulting@tmlt.org and we can look into that further.
Do the compliance rules allow for importing signed consents into EMR, for example, using DocuSign and scanning into the EMR?
I think as long as you get the a copy of the signed um, consent somehow, whether it's on paper and you scan it in or electronically, I think you're fine.
So next question, the tricky one, how is standard of care the same for telehealth when the doctor is not able to do the physical exam? What if we cannot get vitals? I think this is what makes it difficult, particularly in the state of Texas. If you feel that you can't meet the standard of care for a telemedicine visit, then that's probably not going to be the best avenue for that particular patient. Kathy, feel free to expound.
I think that's true. If you are concerned about respirations, if it's maybe a pediatric patient, you can always have the parent count the respirations. You can have the parents count pulses, or a person check their own pulse. May not be the most accurate. Um, Lots of people have home blood pressure devices. So, if that's an important piece of what you need, that may be something you want to encourage your patients to have so that you can better help them through telemedicine.
So I am licensed in Texas. My patients are in Texas, but I am currently living in another state. Would I need a license in the state where I live? My understanding is based upon where the patient is at, and where you are at. I, I may defer to an underwriter on this one, to be honest, just in case there would be something that I would be missing.
Now, that might be one if you would just email us at consulting@tmlt.org, we can get you more information on that. I would also say it depends on the state that you're licensed, or the state that you are living in, because they may have a requirement that if you're doing telemedicine from that state to another state, that may require a license in that state. Is there a deadline for the telehealth or telephone visit? We don't know of a deadline. I would say, based on some of the data that we've been seeing the last few days in Texas, it is very likely that those aren't going to go away anytime soon. Obviously, Texas and around the country, we're seeing a resurgence of COVID cases. So don't think that that's necessarily something that we're expecting to go away anytime soon. I think this next question has something similar. It's a lot of the payers only were approving telehealth until June 30th, and it has not been extended. I think that's going to be a case-by-case basis what the individual payers do. Again, I'm not overly optimistic based on the number of cases that we're seeing in parts of Texas. So I would just say look at um, look at those carefully, and if you have any questions, reach out to the payer.
There are a couple of questions here about reimbursement. Rates are different by phone only versus face-to-face. With Medicare, Medicaid, they're saying same rate currently. Uh, and then if the exam and what you're charging, I would refer you to the TMA if you're in the state of Texas. They have some great resources specific to billing, particularly related to the COVID-19 pandemic.
There is a question about SlideShare, and those are only available in the media player or on a player on SlideShare, and I believe that's correct. If you are interested in that particular SlideShare, if you'll send us an email at consulting@tmlt.org, I will get with our marketing department and see if we could get those to you in a PDF format. Can an MD have an MA see the patient in the office and the provider be at home? They took vitals, etc., and the physician finished the visit over video. I do not particularly or personally think that's an issue. I think we've seen some examples of where having someone at a remote site and the physician not be at that same site has been a model that has been being looked at, especially in other states. But again, I think that would be a telemedicine visit. That's not going to be an in-person visit, so that if it came time to bill it, make sure that's the way it was being billed.
So this does not talk about cyber risks from using different technologies or working from home. We did not really get deep into that. We'll reference what Roger Savigno with the OCR has said, is that they're wanting to empower you all to be able to serve your patient population, and they are going to exercise enforcement discretion and waive penalties against providers that serve in good faith through everyday communication technology. So again, making a good faith effort, trying to be vigilant, trying to make sure you have some security, passwords, those types of things in place, secure internet, to reduce your cyber risks.
Can we use regular email for patient communication since it is not HIPAA compliant? A couple of things on that. A patient has the right to receive information in the form and format that they desire. And if that means that they are saying they want you to email something to them, then you can do that. You have to explain to the patient that there is a risk that regular email is not secure. And if they insist on having that communication in that way, you should go ahead and use regular email. If you do not have an alternative that you can use that the patient agrees to.
So urgent care clinic doing telemedicine, is there any specific telemedicine with urgent care? There are some resources that are available for emergency care through CDC as well as TMA that we can send to you, or if you want to check out their websites, that you can find some information specific to emergency medicine.
And I actually have worked with an urgent care clinic fairly recently, and I don't recall the specific platform that they chose, But one of the many resources that TMA has on their website is a vendor evaluation tool. And so that might be something you want to take a look at. First of all, you want to make sure that it integrates easily with your EHR if it's a standalone system, because you don't want to make documentation an extra difficult task.
Can we use
We've already
99215? Yeah, for a telephone visit for coding. Again, I would reference the TMA coding guidelines. Unfortunately, Kathy and I are not coders, so that's outside of our scope.
If you have an established patient who is a Texas resident who's traveling or vacationing in another state where I'm not licensed, can I do a telemedicine visit and call in medications? I believe you can. I believe that's one of the exceptions that I have heard some of the TMLT presenters who are attorneys have specifically talked about that. Their caution is if it extends for a period of time, then, uh, if they're going to be on vacation for 6 months, maybe they want to establish care in that state.
So I wanted someone from TMA to look over my work. Can we pay someone to do this? TMA does offer, or at least they did at one point offer, reviewing and doing audits for billing and coding. If you're a TMLT policyholder and looking for a review, TMLT also offers practice reviews to their policyholders.
With dementia patients, can we consider discussion with the power of attorney as a telemedicine visit? That's a really good question. Um, that might be one that if you would shoot us an email, uh, I would like to actually look into that a little bit. I my in, my first impression is that yes, you probably can, just as though they were sitting there in your office and you were having a discussion with their caregiver or power of attorney. So, but if you shoot me an email with your uh, email address, we can certainly look at that one and get back with you.
Can
I'm
we
getting a
use
message.
DocuSign? Go ahead, Kathy.
Oh, I was going to say, I was getting a message from our marketing department that you can actually, with a LinkedIn account, you can download SlideShare.
Using DocuSign for consent forms. I think we touched on this earlier, and I do believe that DocuSign has a format for healthcare providers specifically if you're looking to use them for those forms.
Will there be any resources catered to testing for healthcare staff members? Not sure what kind of testing that you can get that you're referring to. Perhaps you could further elaborate on that. This is a 30-minute webinar, and it is not approved for TMLT's CME discount. That discount applies to 2-hour CMEs. The next question is for after-hours phone calls, after properly documented, discussed, recommendations given, and management outlined, can we bill those as a telephone encounter? I would say perhaps you can do that. Um, Again, we're not billing experts. Would invite you all to consider joining us next month for Managing Medical Records Releases for Children and Young Adults. It's a topic that our risk management department gets frequent questions on, and we thought that with the end of July being right before schools and colleges are starting to come back into session, that this might be a really good opportunity for you all to really get some questions answered. I don't see any additional questions. Cassie, do you?
I think there was another question that just came in.
Can you do well annual exams on telemedicine? I believe that there is some guidance on the Texas Medicaid website on doing uh, well child exams. And if you are unable to locate that, if you'll email us at consulting@tmlt.org, we'll help you find that. Well, thanks everyone for joining us. We hope we'll have a great afternoon. Please stay safe, and if you do have questions following the webinar, we are available at the consulting@tmlt.org.